Hi, everybody. Welcome back to another episode of the Slimming Surgeon podcast. I am your host, Dr. Candice Kickler. Today, we have Crystal Murrell. She is a wife, a mom. She has gone through a weight loss journey as well as a plastic surgery journey of her own. She's on Instagram as Fashion and Fitness 316. And I want to talk to her today and let everyone hear her side of the story so we can have a patient's perspective, a mom's perspective, a body transformation perspective, and just get all the details. So welcome, Crystal.
Thank you so much for having me.
Of course. So we met through a mutual friend, Natalie, which you guys have all listened to on the podcast before. Yeah. And she just had to connect us. So just go ahead and tell us your story.
Yeah. So I had my first child when I was 35, and I had gained 80 pounds in that pregnancy.
Okay.
And I'm only 5'2", started off at 116 pounds, very lean muscle. I love working out. It's always been a big passion of mine. And so for me, it was just like, what is happening to my body? Like, I have all these friends who get pregnant and they're just perfect and lose their weight in 3 months. And I'm just like, how is this even possible? And then I had my second child, already going into it knowing that I'd probably need at that point a mini tummy tuck and maybe some fixing to do, but it wasn't as dramatic of what I needed once I ended up getting pregnant the second time around. And that time I gained 100 pounds.
Wow.
And that was me even, I was working out, I was trying to eat right, do all the right things. Granted, I've always been the type of person that I eat in moderation. I don't really count my macros or anything like that. I just try to do what I know is right for my body in terms of food and dieting.
Sure.
And it was like, I don't know what, even my doctors
you
were
like a whole human.
Yeah. Even my doctors were like, they tested me for preeclampsia. They had tested me for diabetes. I mean, all the things, and there's nothing wrong. Mm-hmm. And so at the end of my pregnancy, I was talking to my husband. I'm like, listen, I need to lose this weight. And once I do, I have a feeling I'm going to need more than just a mini tummy tuck.
Yeah.
It took me about 3 years to lose the weight.
Okay.
And at this point, so when I had my first child, after I had her, I would just bring her to the gym with me. I mean, we have a really nice at-home gym. I would just put her down in a pack and play or whatever, and just let her do her thing. I'd work out, feed her, go back and forth. And then when she got to the point where she was more mobile, I started creating like stroller exercises. So I'm like, okay, how can I still do this with her and get this weight off? But with the second child, it was a lot harder.
So much harder.
Yeah, so much. So I told my husband, I was like, listen, we need to hire a nanny for at least 3 hours a day, 5 days a week, so I can dedicate myself to this journey because I had a lot to lose. Yeah. And so he was like, okay, listen, let's just work on losing the weight. Once you do, we'll figure out what you might need.
Gotcha.
So when I was like a year and a half, 2 years into my weight loss journey, I started researching doctors like right away. Cause I'm like, okay, I don't know what I need, but I know I need something. Right. And I came across Dr. Ratana out of DC, and I fell in love with his work because everything, you can't just look at one picture or have one friend tell you like the surgeon's great. I want to see consistency in that work and know that, see the different body transformations. And he specializes in 360 lipo, BBL, and the tummy tucks, like pretty much the full mommy makeover. Right. And so finally my husband agreed, and I reached out to my doctor, and he was like, I want you to show me pictures of what you want to look like. And so instead of just going on the internet and finding like hot chicks and here you go, I look like this, I found pictures of myself and said, I just want to look like this again. I just want my body back. So he said, listen, if this is what you want, I need you to lose at least, or get down to at least 136 pounds. Okay. I want you to keep at least 10 pounds of weight on you. for the transfer if we need it.
Right.
And when I lost all my weight, it wasn't just that my stomach was saggy. I literally had like saggy butt. It looked like 2 pieces of pizza ate a cheeseburger, and it was literally like flat and then just like chunky at the bottom. I'm like, oh my God, what happened to my little tiny pricky butt that I used to have?
Yeah.
So it's funny. There's so much stigma around BBLs.
Yeah. Especially here, like in South Florida, they are, notorious. You look like Kim K, but like crazier, there's a lot, like you said, of misconceptions.
And I didn't want like a big fake butt, and I didn't want to walk around looking like Kim, but I wanted to fill that skin. And the only option is lose as much weight as I can and add some fat in it. So that's what I did. So it's funny because people are like, oh, you had a BBL? I'm like, yeah, but if you saw my butt before kids and then you saw my butt after kids, you would completely understand. Even my mom was like, what do you mean you need a BBL? I was like, Mom, let me show you. So I literally showed her the videos and pictures of me before and after. And she was like, oh my God, Crystal, you had no butt. And I come from a family with like perky butts. I'm like, how do I not have a butt anymore? So it's not just for someone to look like a big fake butt. It's just to feel normal again and feel like yourself again and recognize yourself in the mirror.
Exactly. Right. So it was a big transformation for you and a long transformation. So let me ask you a couple of questions. Like how much weight did you lose before you got pregnant with your second? Like, were you able to lose so you lost all of the 80 pounds?
It took me a year, but I lost all of it.
And how many years apart are the two?
They're 2 years apart, 2 years and 2 months. Yeah. Okay. So my husband and I, we were like, listen, as soon as because I told him, I was like, I'm not getting pregnant again until I lose all this weight. Because I didn't want to carry the extra 10 or 15 and
then never lose it.
Never losing it. Yeah. So I was like, in order for me to do this and to, go for round 2, I need to lose it all. So I really did what I could and I lost it all. Yeah. And then I was like, okay, let's go. So I was maybe I want to say I was 126 pounds when I went into the second pregnancy, but I was way leaner and more muscular. So although I started off my first pregnancy journey at 116, the 126, that was like 10 pounds of just lean muscle. Yeah.
Okay. Gotcha. And through your weight loss journey after your second baby, you wrote to me, like that you went to a weight loss clinic and you were like, they kind of counseled you and told you what to do, what to not to do. Like, walk us through that, because I think it's interesting for people to hear what other people can recommend as far as like diet, medications, things like that, and how crazy or not crazy it can be.
Yeah. So I will say I was very mentally set on, I did it once, I'm going to do it again by myself. I don't need a weight loss doctor. I don't need pills. I just need to work out. Well, that last year in that like 2.5 year journey of trying to lose the weight, that last year I could not budge the scale. Like, it did not move at all, no matter what I did. I tried even going on different diets, keto diets, intermittent fasting, like you name it. And I even tried, like, people say, you don't need to do cardio to lose weight. You need to, build muscle. You need to strength train. So I was like, okay, let me give that a go and see if that works. Nothing. I was just like flatlined. Yeah. And I had about 3 months before my surgery, and my doctor books like a year in advance. So I'm like, I cannot miss this opportunity. I need to get this weight off. And I didn't want to do it in an unhealthy manner and just starve myself. Right. So I went ahead and I said, you know what, I'm going to suck up my pride, go to the weight loss clinic. Yeah. And they advised me so at first they put me on metformin and they put me on phentermine. And at first I was like, okay, awesome. And then they also told me, we want you to stop whatever you're doing in the gym. And this is what we want. Yeah. They were like, this is what we want you to do. We want you to do 15 minutes of light cardio and or not light cardio, but like light weightlifting and stuff like that to get your heart rate up. Okay. And then I want you to get on the treadmill and I want you to walk or power walk at whatever pace gets your heart rate at 130 beats per minute. because I
Okay.
guess that's when you're in like the fat burning zone.
Okay.
And they said, I don't want you to go too much above 130 because you can overexert, and I don't want you to go under.
Mhm.
So for me, that was like at a 3 on the treadmill speed. It was like nothing. So I would go to the gym 5 days a week and just like power walk miserably because I'm like, this is so boring. I need to work, especially for somebody who likes to lift weights and work out. That was like,
well, they were probably considering like other people's baseline, which is sedentary. So like for you, that was like almost going backwards.
Yes. I was like, how is this going to work? Well, 2 days into the Phenermine, I was like, oh my God, I can't take this stuff. It was like, I mean,
were you anxious? Were you jumpy? Like dry mouth? Like there are a lot of different side effects that different people have.
Definitely dry mouth, jumpy. I don't know if this is like inappropriate to say, but from what I've
say
heard,
anything.
I was gonna say, so from what I've heard of people who take cocaine, that is what I felt like.
Okay.
It was like this crazy rush of a high. I was just like talking all the time. My husband's like, Crystal, you need to chill on the Phenermine. I was like, I'm doing what the doctor said. So I was like, I have to stop this. So 2 days in the Phenermine, that was actually making me to the point where even chewing food, I couldn't do it. So I was like, first, it makes you not hungry. That's what it's supposed to do. So it's working.
Exactly.
But to the point of even just putting food in my mouth, I was like, oh, gross, I can't do this. And I needed an intake on my calories because my weight loss doctor said, I think your problem is you are working out so hard and you're stressing your body so much, but you're not taking in enough calories. Because I had this whole like weight loss calorie calculator in my head of, okay, so if I want to, because I think it's like you need to burn, is it 3,000 calories or something like that to lose 1 pound?
Right.
So I was like, and I need to lose this weight fast. So I was like, this is what I'm going to do.
So you're putting yourself in a negative every day.
Yes.
I tried that. It didn't work.
Yeah. And then whatever I was eating, my body was like, nope, I'm holding on to this.
Exactly.
Like, we need this, like, done. So it kind of like worked against me doing that. So I did what the doctor said, minus the Phenermine after 2 days. And just 1 week of being on the metformin, I lost 10 pounds.
This is crazy.
I was like, I was mind blown because I was going to get the, what's that shot called that everybody's doing right now?
Ozempic.
Yeah. So I was going to do that. And they were like, no, you have to start at a small dose and work your way up. And it takes longer for it to work. But when it starts, it works. And they said, let's put you on the metformin. It's very similar to Ozempic, except that it's in pill form. And you just literally take 1 pill after breakfast every morning. And I mean, it was like my holy grail to this journey because 3 months away from surgery and I need to hit that goal weight and I'm not there. I couldn't believe that 45 minutes of walking on the treadmill and taking 1 pill a day, like 10 pounds, it's insane.
It's definitely very effective. And some people, the metformin, some people not as much, like in your case, but it probably just goes to show you that your body had some degree of like insulin resistance. Like it wasn't exactly functioning the way it did before the babies.
Yeah.
And that's when you have to call in for help sometimes. Like you knew because you were at a plateau, like you couldn't lose any more. And so you phoned a friend, like you called for help, you got what you needed to. And it was a good tool for you. Are you taking any medications now that you're like way out from your journey?
No. So now that I've lost it all, I kind of just eat in moderation like I did before I started having kids. And I've been able to maintain my weight. I will say my weight it's crazy because I thought if I keep the 10 pounds on and they do the fat transfer, they're not using all 10 pounds in my butt. You know, like I'll probably still lose some weight. And it was ironic because I actually didn't.
Yeah.
So I went in for surgery at 134 pounds and I came out at 134 and stayed that way.
Yeah.
Give or take a few pounds when I was swollen.
Of course.
But now it's like my waist is at a 26 and my hips are at a 39. So I will say the only thing, so when they do the fat transfers with BBL, they have to add, I think it's like 40 to 60% extra fat to account for any fat loss during the fat transfer.
Right.
Well, I must have been some weird freak of nature because
you saved all of it.
Loves fat. Like none. I was like, oh my God, for the longest time, I've been talking to Natalie and I'm like, this is not right. Like I need to get rid of some of this, but so you're not allowed to like sit on it or lay on it or anything for like 6 or 8 weeks.
Yeah.
And I was like, I don't care. I had like 2 weeks to go. And I told my doctor, I was like, I'm going to start sitting on it and laying on it. Some of this needs to die. Like I can't have this butt on me.
That is so funny. You are definitely one of the rare birds because most of the time people want more or they literally do and they get a second round. Yeah. Yes.
And I was like, he's like, well, at least you won't ever need a second round. I'm like, yeah, but now I'm contemplating doing a little bit of a
reversal.
But I don't want to go through that anymore. So I'm like, listen.
No. Yeah.
And I asked him, I'm like, what can I do to like lose some of this butt? And he's like, lose weight. And I'm like, oh,
yeah,
again.
I know.
So I haven't gone down that path, but eventually I think I'll start gearing towards losing a little bit more weight. But
when it feels right for you. Right.
Yeah, exactly.
So let's go back over exactly what you did. So you told us like you researched your surgeon for a while. So like you kind of thought about it. You had the like idea between baby 1 and baby 2. And then after baby 2, like that kind of sealed the deal. Yeah. You knew you had to lose weight to get there. And then you emailed it to me, but I want you to tell our listeners, like what procedures did you have? Because it wasn't just like, oh, I just had a tummy tuck. Like, no, you had several things all at one time, but that's what you needed to get to your goal. So go over that with us.
And I am one of those people that when I gain and lose weight, I gain and lose it all over. So for me to leave 10 pounds of fat on me would leave it on my arms, my inner fat, like all the places. So in order for me to have that look, we had discussed, we're like, okay, so I ended up doing arm lipo. I did inner thigh lipo. This is going to sound weird to some, but knee lipo.
No, knee lipo is very popular.
Yeah.
We just hold on to weight on our knees, some of us, the so unblessed, weird. And it is so horrible.
Yes.
Just get rid of it.
Like wearing boots, like if you wear like knee-high boots and then you have that roll over, I'm like, I never had that before. Like, please save me. So I had the knee lipo. I had, I think I said the 360 lipo.
Okay. And that's like abdomen and flanks for some other people listening. Okay.
Yes. And I had abdominal repair because I had about a 2.5, 3 inch gap in my abs.
Your diastasis.
So
yeah.
And then they found an umbilical hernia when they went in to do the tummy tuck. And so he was like, listen, I hope you don't mind, but we fixed your umbilical hernia while you were asleep. That's going to cost X amount of money. And I was like, no, do it. Take it. Like you can have it. Thank you so much.
Wow. That's so interesting. Okay.
I guess if you have an umbilical hernia, the only way to get in is to cut. He's like, you have to have another surgery.
I fix them all the time, but I never think about like charging afterwards, but whatever. Yeah. I'm glad that he did it for you.
And I will say so the one thing I did love about the surgeon that I chose was everything is included in this one price.
Yeah.
So if you have to go back and get drained, if you have any issues, if you need to call him like 2, 3 o'clock in the morning, like he gives you his personal number and the nurse's number. So you can always reach out to somebody.
And that's very important because a lot of people listening today might be considering going to get surgery like out of state or far away or in another country or, you know, someplace that's really inexpensive. And these are the things that you're paying for. You know, you're not just paying for the surgery. You're paying for the aftercare, the direct contact with your surgeon, seeing your surgeon after surgery. And those are all things that I do as well. So it's reassuring that you had such a good experience.
So for instance, after my surgery, I think I was about 3 days in, I woke up, I have like that overactive mom bladder that literally gives, I mean, I get my eyelashes filled and I'm like, can you stop for a second? I have to use the bathroom.
Yeah.
And so 3 days in, I woke up in the middle of the night and I felt like I had to pee. And I go, and mind you, 3 days in, I'm still having my husband help me get in and out of bed because it was really hard with the full tummy tuck from hip to hip being able to get in and out of bed, zipping up your fob, bending over, like all the things.
Mm-hmm.
And so I asked my husband, I was like, I have to go to the bathroom, which obviously he didn't mind, but like I couldn't go.
Mm-hmm.
And I was like, okay, this is strange. So my husband's like, all right, babe, I don't think you have to pee. Maybe it's just the medicine. Let's get back to bed. And I was like, okay, get back to bed. I mean, I probably did that like 4 or 5 times. And I'm like,
oh, wow.
I don't think something's wrong. Like something's not right.
Yeah.
And so the next morning, I finally fell asleep. The next morning, woke up, still couldn't urinate. And I'm like, okay, we have to call the doctor.
Yeah.
So we called the doctor and he said, come in right away. Like, that's not good. You need to come in.
Yeah.
And when I went in, they ended up having to put a catheter in me, set me home with a catheter. So now not only am I like walking hunched over, I've got all these phones, all these like things on me and like the full faja. And I'm like walking like this with my bag of pee, like out of the, like, oh my God, this is so embarrassing. And of course I'm in DC. So I'm like walking it through DC, like with my bag of urine, like,
oh my gosh,
it's terrible. And then I had my drains at the time too.
Okay.
Because I had to have 2 drains in my pelvic area. And he was like, okay, we'll contact your physician. He was like, I've only had this happen to one other patient.
Yeah, that is really rare, especially that many days after surgery. Usually it's like right away if we see it. You never know. Things happen, but that's why you want to have their phone number.
Yes, exactly. And be close by, because if not, you're going to the hospital spending how much more money.
Right.
And that money,
someone who doesn't know, it could be taking care of you. And like the problem with, going back and forth to like the hospital or different places is that you're exposed to more bacteria that way. Like it's a whole nother bag of worms.
Exactly. So I had my catheter for like 2 days and they put me on some sort of medicine that helps you urinate. I forgot what it was called, but they put me on a special medicine. And then within a few days later, they took the catheter out and I was perfectly fine. Thank God.
Yeah.
But
did you do anything with your breast too? Or was it just the body?
So I've had my breasts done twice.
Okay.
But the first time I had them done, I was 25. And then that doctor, oh my God, he pretty much gave me Franken nipples, like Frankenstein nipples. They were horrible. One was like in a triangular shape, and there was
no.
That's what you get when you're 24 years old looking for a plastic surgeon. You go in at 25 after saving up all your money.
Yeah,
you're like, I'm getting a good deal. It was so bad. And I also had silicone at the time, which creates a lot. Side effects, I guess I will say, in some is rippling. So not only did I have like crazy looking nipples, one in a triangle, and then I also had all these like wrinkle lines, and I'm like, oh my God, help me. So
you had silicone or you had saline? Because usually the saline does the rippling. It doesn't matter. You had them change.
No, I'm pretty sure it was silicone because I have the salt water now. That's saline, right?
Oh, okay. Yeah.
Yeah.
Okay. You must have had like an old model. Yeah.
Yeah, no. Yeah, really. Well, I'm 40 now, so probably had a very old model. That was 20 years ago or 15. But so then I went back about 8 years later and I had my breasts redone.
Okay.
Just because I wanted to like fix my nipples, get rid of the rippling. I was getting married in a year or 2 and I just wanted to feel good. But I will say I almost regret not waiting a couple years until after we had children.
Yeah.
Because when I gained the weight and I lost the weight, my boobs. So when I was younger, I had like inverted nipples, not inverted nipples, but like inverted boobs. I had no boobs. I was so flat. And so when I gained weight though, I'd have one little boobie that would like fluctuate and I'm like, hey, feeling happy. And it was just like, but the other one never budged. And so when I gained all the weight having my kids, and then I lost all the weight, had the mommy makeover, one boob is now a little bigger. Okay. And also, I think one dropped, and the other one's like a perky little implant still, with the others like small boob. So I'm gonna have to get them.
Yeah, next project.
Yeah. So they said you have to wait at least a year before you have any other cosmetic surgeries, because I had so many things done at once.
Yes. Yeah.
So like
exactly.
wait a full year until you're healed, and then we can revisit the boobs. So
Right.
we're revisiting that shortly.
Gotcha. Okay. Yeah. I was curious if you did everything, because that is a lot. Like you did quite a bit of surgery. How many hours was your surgery? Do you know?
So when I went in for like the pre-consultation, like a few days before, they were like, okay, so you're going to be under anesthesia for about 8 or 9 hours. And I was like,
Yeah.
what? I was so scared, to the point I was like almost second guessing it. Because
Yeah.
now I'm like, I've got 2 kids. If something goes wrong, like, is this a very selfish decision I'm making? And some might say yes, but also part of that whole journey is so mental,
Yeah.
especially for someone who used to live a very active, fit lifestyle. You gain all this weight, now you have the loose skin, and you go through these 2 huge body transformations over the course of the last 5 years.
Mhm.
I was so depressed and I was so sad. Like, I remember, so Natalie, who we met through, so she would always like, Crystal, just come out. Like, you're beautiful, you're fine. And I'm like, I'm not ready for the world. Like, I don't feel like myself. And when you don't feel like yourself, your personality isn't you. And who you are on the inside isn't the same because of how you perceive yourself on the outside. And it was so hard for me to be like, there's so many women out there who I am so envious of, and they're like, this is who I am. I don't care. I had 2 kids and I love my body no matter what. I wish I could be like that. I am so envious of that. But for me, it was like, I just felt like I just didn't, everybody's different at the end of the day. And that's okay. I think that's what makes this world a beautiful place, is that we all are different. And for me, I didn't like being a different version of myself. And for me to be the best mom, the best wife, the best person, the best friend, I had to feel like myself again and be happy and find that happiness. And as vain as it might sound, that, being able to wear my clothes again and feel confident in the person I am on the outside gave me back the person who I am on the inside. Yeah. And that, to me, I was like, chances are I'll be just fine on anesthesia.
Yeah, right?
We're good. So I did it, and I would do it all over again in a heartbeat. I would go through the same struggles, the same journeys, the same mental, pain that I felt going through these journeys. And, the one thing that I've learned in life is I've been judged when I was too skinny. I've been judged when I was too fit. I've been judged when I was too overweight. I've been judged after surgery. Unfortunately, we live in a world where we love to say women support women and, we all love each other, kumbaya. But at the end of the day, it's bullshit.
Yeah.
People are always going to judge others. And I can get over being judged, but what I can't get over is me judging myself and me not feeling comfortable with who I am. So at the end of the day, if me having 1,000 surgeries in one setting to make me feel like myself again, I would do it over again 1,000,000 times.
Yeah. And it's so true. It's so true. Like, we are so easy or quick to judge others, but you're 100% right. Like, if you don't have that confidence in yourself, you can't shine your light. Like, you can't be the person that you want to be and be there for your kids and be there for your husband and for your whole, everyone you come in contact with. If you don't feel good, and a lot of feeling good can come from looking good, then you can't do good or do as good.
Yeah, exactly. And I would also think, this sounds so bad, and my husband was so great to me. Like, if anything, I was the one, and I was like, can we just glory hole it? Because I don't feel comfortable taking these clothes off. I'm like, can we just put on the robe and like, you do your thing, we'll just forget it ever happened.
Yeah.
I was so self-conscious.
And that's what I get from a lot of women. Like, my confidence, like, in the bedroom, with my husband is shot, like, after kids. And to restore that and to restore that relationship is huge, because, intimacy is super important for your marriage.
It is, absolutely. And we had the best intimacy, like, before and then after my first child. And And then it was just like, I didn't feel comfortable enough to give that to him anymore, or to be that person in the bedroom. And having my surgery and having my body back, it was so funny because I kept telling my husband, I was like, when I have my surgery, I'm going to be on new girlfriend status. And he's like, what do you mean? And I was like, a brand new body. I was like, oh my God, think about it. Like when you meet somebody new for the first time and you have sex with them, but this is even better because we've done it before. So we know what we like. And it's like new sex with someone, you know, it's going to be amazing. And he was like, I don't understand what you're saying. You're still you. And then the first time we actually had sex, when I was healed and I felt good, and I was like, let's do this right. And he was just like, I completely understand what you were saying about the new sex thing. And he's like, I completely get it now. That was amazing.
He was like, worth every penny.
He's like, we haven't done that in like 5 years. He's like, oh my God, this is great. So there's so like, I didn't want to.
There are layers to this. It's not just about having surgery and looking good. Like exactly right. Yeah.
I mean, and I would feel bad for my husband because I'm like, I don't want to walk down the street with him and have people be like, oh God, she let herself go after they had kids and got married. Like she sealed him down and let herself go. Like poor guy. Like, I just,
and that's something that unfortunately as women, we have to think about, you know, like, and you're right. There are some people who can wave their flag and just like rock it and don't mind the changes that their body's doing it. Yes. Yeah. But there's others who don't. And we are obviously, you know, we get a lot of criticism after kids. If we don't snap back by a certain point in time or do the things that we need to do to fix ourselves, in quotes.
Yeah. You know? And I think the saddest part about that is that, so I actually started the fashion and fitness Instagram page when I got pregnant the second time and when I saw myself trending in the same patterns as the first. Because I was like, I want to document my journey and I want other women to not feel alone, to not feel like they're the only people out there going through this, because there's a lot of women who actually do get extreme weight loss or weight gain when they're pregnant. Yeah. And I remember going back the first time postpartum and hashtagging like 4 months postpartum. And it's like, they're in bikinis with rock hard abs. And I'm like, what is wrong with me? Like, why? I was so tiny before, I was so fit before, like, why isn't this me? And you just feel so alone. And when I started this page, this Instagram page, I connected with so many women who feel the same way that I feel, who feel so ashamed by what happened to them after children, but also want to have the surgeries to fix certain things, but also feel shame of doing it because they don't want to be judged or criticized or have people tell them, you know, why would you do that? Or that you're fake or you're plastic or you're this, you're that. It's not about that. It's about feeling good with yourself. And at the end of the day, I don't care what Tom, Dick, and Harry think about my plastic surgery. If I feel good about it, that's all that matters. If my husband's okay with it, if my children, you know, supported me through it, like that means so much more than what other people say. Like I've had so many women who are like, oh my God, I've been wanting to get a tummy tuck, but I've been so afraid. And, you know, I just don't want to be judged. I'm like, who cares what they think? If, you know, these women are the same women who are going to judge you no matter what. If they're going to judge you,
exactly.
If they're going to judge you, they will judge you no matter what. And it's kind of sad.
Exactly. And there's only so much after you've had several children, especially, there's only so much that the exercise is going to do. You know, like you can't completely repair the diastasis or that ab separation. Yeah. Once you've had multiple kids with just exercise, like a lot of times or sometimes after maybe one baby, your body can kind of retract those muscles if you do the right things at the right amount of times and you bind your waist and do all these things. You know, it can get better usually after the first baby, but usually after baby 2, baby 3, baby 4, especially, like there's no turning back. You're not going to fix that by doing yoga. And that's what's like the big also like misconception amongst people who haven't had surgery or needed surgery or wanted surgery is that they perceive that people are just lazy and that you just don't want to work out and you just don't want to do all these things. But at the end of the day, this anatomic change that your body goes through can't get back to where it was unless you have surgery at a certain point.
Yeah. And like I said, I'm kind of a prime example of that. I didn't want to see a weight loss, go to a weight loss clinic. I wanted to lose all my weight on my own. I wanted to build my muscles back and do all the things on my own. But no matter how many hours I spend in the gym, how much kale I drink and chicken I eat, none of that would have gotten rid of the loose skin on my butt or the loose skin on my stomach.
Right.
And at the end of the day, I worked so hard to be able to do this surgery. When I talk to other women, I'm like, if you're going to do the 360 lipo, the BBL, do the mommy makeover, get yourself to a point of where that surgery is going to be worth it for you.
Yes.
Because if you go in, say if your goal is to be 120 pounds, but you go into surgery at 150, you're still going to be about 150 when you come out, maybe 145, 40, but still you're not going to have the body that you really ultimately wanted. And then what? You're going to have to do the diet and exercise at some point. You're going to have to drink the kale and eat the chicken,
Exactly. I do talk to people about that all the time. It's like the ideal situation is to get within 10 pounds of your goal weight when you're going to go into surgery, because that way, you're really healthy, you're fit, your body is functioning at a great level. You go through the procedure, you're able to recover, and then you're not still then needing to do more work afterwards.
And you're able to maintain it easier.
Yes.
So, there's so many benefits to waiting until it's the perfect time. And I feel like if I have any advice for anybody, that would be it, is make sure you're at a point where that, because it's a major surgery. Like I said, 8-9 hours. And as in the recovery, oh my God.
I do want to talk about that. Like what kind of things did you do for your recovery? Like you talked about your faja. Let's talk about fajas. Like how were you zipped up in a faja and sent home? Like, is that how you were placed in yours, and foams? Like go through some of that with us, because I want people to hear it from your side.
Yeah. So like I said, I had 2 drains in my pelvic area. When I left the hospital, I was in a faja from my knees to my elbows.
Yeah. That's the liposuction that you had. Like, that's why you had that much compression. Okay.
Yes. And then I also, because I had the knee lipo, I had to have compression socks. So, and my doctor, I guess he has his own faja line. And so he provides you with your first faja. And he, put everything on it. And I will say, for anybody who's going through these surgeries and needs a faja trick, so one of my surgeon's patients did this thing where she took a string and put it on the zipper of her crotch of the faja. Because when you have a tummy tuck, you can't be bending and stretching. And so literally I could just grab that string and I could unzip it. It's long enough that I can pull and unzip it all the way to the back and have full access. Because if I didn't have that string, zipping and unzipping the faja would have been... You would need
another person, 100%.
Yeah, it's so hard.
Well, faja is hold on, we should tell people because maybe they don't know. Faja is like a compression garment. It's kind of like a super tight Spanx. It's got thicker layers, like a corset, you can imagine, but like some type of bodysuit situation. And they usually zip up and down so you can get them on and off, but they're for compression and for healing and recovery after the surgery. They help with the swelling and the drainage and all the things. But in South Florida, we always call them a faja, but I guess it's kind of like a universal term. And we love our fajas. Fajas are good for after surgery.
Yes.
How long did you wear yours for?
So I wore mine for 3 months.
Yeah.
So, and I will say too, just to add to your description of the faja, the only thing that does not have compression is in the booty area.
Yes.
Because of the BBL.
Especially if you have a BBL. Exactly. Right.
No, if you're not, I'm sure you can get, you have one.
Yeah. They're different based on what you're having done.
Yeah. So mine, for instance, was like a soft nylon fabric, stretchy for my bottom so that it wasn't compressed at all.
Yes.
I did end up, it was funny. So when I went in before my surgery, the pre-op appointment, they gave me this list of things that I needed to buy. And thank God for that list, because there's some of those things that like, if I didn't have, I would die. Like a back scratcher. I'm like, thank God for the back scratcher. And so they had me get maxi pads for my elbows.
Yeah, for drainage, liposuction.
Yeah. And then I had to get pee pads, like doggy pee pads.
Yeah.
I guess they're like the medical pads.
Yeah.
I had to lay those down on my bed, like anywhere that my body was going to be, like those pads were there. Because
we're making this sound really, really crazy, but look, she's here today. She's happy she did it.
So happy.
And it's not that crazy, right? Like I typically don't do surgeries that are that long, but you know, in your case, you had a lot. And so that was customized to you. You know, a tummy tuck can be an hour to an hour and a half, you know, liposuction can be separated from the tummy tuck. Everything that Crystal's talking about today is like customizable to you. Like you decide what you want, like the degree of transformation you want to have. It also, you have to take into consideration like where your body's holding fat, where it's not holding fat. If you need a mini tummy tuck or a full tummy tuck. So we don't want any of this to scare anybody. It's more informative and you just like hearing, you know, your journey. I love it.
Yeah. And like I said, I would do it all over again in a heartbeat. Like if I had to go back and somebody was like, listen, if you have kids, this is what's going to happen to your body. And this is what you're going to have to do to fix it. I would say, give me the babies. Yeah. Give me the weight. I'm doing it. It was all worth it in the end.
Yeah, of course.
And in the long run too, like it's funny. So when you have a full tummy tuck, your surgeon creates a new belly button.
Yep.
And so you also have sutures in your belly button. And I always I liked my stomach kids, but I always felt like my belly button was like a big, I had a flat stomach with definition, but yet that little section down the middle, this area right here was always a little puffy. And my belly button was this deep crater hole. And I would always joke, I'm like, I could stick half a pinky in it. It looked like a little butthole. If you got up close, I took pretend this is terrible. And not just any butthole, but one that's been ran through way too many times. That is what my belly button looked like. It was so bad.
I'm really glad you fixed that.
Yes. Oh my God. I love my belly button now. I'm seriously
see, this is really good to hear because so many people are like, I will never get a tummy tuck because of the belly buttons. And it's like, no, most of the time your belly button is ugly in the first place. And two, again, this is customizable. If somebody tells me I want a round belly button, I can make it round. If you want a skinny slit belly button, I can work on that and make it better. Yeah. Most of the time, if you're needing a tummy tuck, you've got this sad face situation or this bad butthole situation going on anyways. So it's only going to get better.
Yeah, absolutely. And not only that, but you get belly button plugs. So if you want a bigger belly button, a smaller belly button, if you kind of want your belly button to do its thing, I would switch up my plugs. So I would go between a smaller size to the tiny marble and the little plug with it's a little plug with a flat.
Yes. And this is not something a lot of people know about. I have to guide my patients okay, it's time to put the marble in your belly button. And they're like, what? It should be talked about more. All of this is on my Amazon storefront. Your surgeon, I have a list of things that are recommended. And that one always throws people for a loop because they're like, what do I do with this?
But they're amazing. And so I look at something like that, my new belly button. I never hated being in a bikini, but I was always self-conscious of my belly button. So I would never wear and I have a shorter torso as is. So I would never wear crops or anything that showed my belly button because if I'm wearing jeans and then a crop and you see my belly button and I go to sit down, it just looks like a butthole. So it's I hated it so much. And now I'm bring on all the crop tops and high-waisted, everything. I love it. So I mean, there's a lot of perks to having this kind of transformation. I mean, and there maybe are some downsides too. I ended up getting fat. I also forgot to say I had fat transfer to my hips.
Okay.
So, cause I was never hippie and I was always very straight.
Yeah.
And so wearing certain things, I never felt right in that, with my body like that. And, And so I was like, you know what? I want to have like a sexier, curvier figure. So I was like, well, if you're going to transfer some fat, you might as well fill in my hip dips. And
Yeah.
so it filled in the hip dips. And on my left hip, I want to say it was like 4 months into it, I felt like this knot in my side. I'm like, what is this? And then I felt it seemed to get bigger. And I'm like, what is this? But just all I had to do was massage it out, and it slowly broke down, and now I don't have it anymore.
Did you go for massages after your surgery, and how soon did you go?
So I had to wait till my drains were removed after week 1. And then once the drains were removed, I did massages. I think it was like 2 times a week for the first couple weeks. Then you go down to once a week, and then you go down to once a month. Yeah. And I will say, when I was down to once a month, I missed it so much. Yeah. I was like, I still go back every once in a while to get my massages and I also will massage at home too. But even to this day, I'm almost 1 year out from my surgery. I had it on January 9th of 2023. Okay. And I still use my massager on my stomach at night. Just so everything kind of stays soft. So my mom told me she had lipo when I was in high school. So this was like 25, 30 years ago. And she's like, Crystal, back then they used to tell you to take a rolling pin. Yes. And she's like, I had to carry a rolling pin into the office with me, and I'd roll my stomach. I'm like, oh my God, really? She's like, yeah, they never suggested massages and all those things. She's like, that's so great that
it was DIY massage.
Yes. She's like, it's amazing that your doctor's telling you to do this. And literally I'd go into a massage and my stomach would be like flat, Yeah. And then I'd leave and I'm like, definition. And from the drain, I'm like, oh my God, this is amazing.
I have people tell me that they feel like a new woman after the massage. Like, it just makes you feel good.
Yeah.
But it's super important for after the surgery. Like, especially if you're doing lipo, like if you're just doing a tummy tuck, like you'll get a great result without doing it. But if you're doing lipo, I just feel like it's so important. I recommend it to everyone. And that's something that you do have to take into consideration for your recovery, because you've got to be able to set that time and that money aside to do your massaging as well. Because it's a game changer. It's just like the faja. If you don't do it, like, your results aren't going to be as good as they can be.
Yeah. So I know somebody who had the 360 lipo done, and it was like a few weeks later, like I see her on vacation and all these pictures, and I'm like, I know you're not wearing a faja. And then she'd be in a bikini and then a little dress. And I'm like, you need to wear your faja. It's so important for the draining and for the pressure. So things don't get lumpy and weird and move around. Like, I just don't get it. And then she ended up having to go back to have some things fixed, and she's still not satisfied with the results. When you pay this kind of money or go through that kind of, pain, and you're taking time off of work, time away from your family, I mean, you have to dedicate yourself. It's just as important to take care of your post-op instructions as it is just going in and having the surgery. Yeah, you don't, do what the surgeons are telling you to do. You can't run back to the surgeon or tell people, oh my God, he messed me up and look at my stomach or this and that. It's like, you never wear your faja, or you didn't do your massages, and you were drinking alcohol and smoking cigarettes and partying. Like, you were taking care of yourself. If you were going to do this journey, commit to it so that you will come out of this 3 or 4 months down the road thinking, oh my God, I'm so glad I did this. I've got no regrets. I mean, if you're going to do it, do it.
Do it right. Exactly. I know when I tell people in consultation that they're going to have to wear a garment for like 3 months, they freak out. And I'm like, listen, it will fly by. You'll blink and it'll be over with, and you'll be so happy you did.
And it's so true, because I look back now and I feel like it was such a long time ago that I had this surgery. Yeah.
And looking at your pictures, like you look so healed. Like, I would not think it was less than a year. So that's amazing. Yeah. That just shows you what that maintenance and what that like time in the post-op period does for your recovery. It just makes it so much faster and so much better.
And wearing your Zika tape on your scar and doing all the things that you're supposed to be doing. I mean, that all plays such a big role in what your outcome is going to end up being. So you can't just say, oh, I had surgery. You need to do all the things after surgery to make sure that your results are going to be there.
And have the follow-up too. Like it's so important that, you know, when you do have this recovery period, that you're seeing somebody who can keep an eye on things. Because if you are starting to develop some scar tissue or like some fibrosis or whatever you want to call it, if you see your surgeon, we can identify that early and say, okay, yes, you need to go get into massage right now. You need to be doing this. You need to change up this. There are things that we can do. Drainage, if you need to drain it, massage, injections, like there are a lot of different things. And with the scars, we can laser them, we can inject them. Like having follow-up is so important. Like, you know, we are super clear with that on our patients. Like, I want to see you. This is when I want to see you, but also call me if there are any problems. And so, you know, if you're going to go through this type of journey, make sure you're comfortable and that you're able to talk to the people who are taking care of you, even if it's like just getting the nurse's phone numbers, just so that you have that line of communication, because you want to feel comfortable and you want to have the best result in the long term.
It's so, so true. And also make sure that when you go to your surgeon, that you do get those follow-up appointments. Yes. Because I was mind blown when I found out, like some of the people that I know who have had these surgeries, they don't come with follow-up appointments. They get like a 24-hour and then the door is closed and then they don't see you again.
Right. Or they charge you to come back. I've heard about that in Miami. Like, we get a lot of people that go there and it's like, you know, oh, I have this problem. And it's like, okay, well, did you go see your surgeon? No, because they want to charge me $150. And it's like, what?
It's crazy. It's so crazy. Like, I know a lot of surgeons will literally say, okay, you've got, come in at 24 hours, come in 1 week, come in at 2 weeks, and then, a month, 3 months, like to make sure that you are doing what you're supposed to be doing and that you're healing properly. Because at the end of the day, what you guys as surgeons do for us, we are your walking billboards. We are your advertisement. We are showing people what your work is. And if you don't have clients that follow through with their post-op care, it's like, no, it's not. And then they look at you like, oh, she did that or he did that.
Right.
Like, no, actually you did that because you didn't do your follow-up like you were supposed to,
I know, but I can't say that. I'm glad you said it for me.
But it's so true. It always bothers me when I hear these people and they're like, oh yeah, well, I wasn't too crazy about my surgeon because this happened. And I'm like, well, did you go back for this appointment or did you do this? Did you wear that? And they're like, no.
Right.
Okay, well, no, you can't
blame a whole other episode.
Yes, exactly. I'm like, you can't blame your doctor then. You did that to yourself at the end of the day.
I know, but it's all good. It's all good. We make it better.
Exactly. And I just wish that more women were okay doing these things to themselves. I'm not saying that I'm preaching get surgery and, try to be a Barbie, but just because you're having a tummy tuck, I mean, there's plenty of women who have tummy tucks or who have 360, lipo or whatever. And they have medical reasons, or they just want to remove some skin. They're not doing it to be a size 0 again. They're doing it because they just want to be comfortable. And it makes me so sad. I know a handful of women actually right now who are all like, I really want to do it, but I'm afraid people are going to judge me. I'm afraid they're going to say things about me. And I'm like, listen, it's not like you're trying to be a size 0 and look like Kim Kardashian. You're average everyday mom living in, doing pickups and drop-offs. If you want to feel a little bit more comfortable in a bikini or in a even if it's a one piece, like that's one thing I was telling some of my friends. I'm like, if I go in and I have lipo and I have any sort of bad things happen or it doesn't come out how I'd expected, or I hate my belly button, at least I would be able to wear a one piece and not see that skin hanging and loose. And I would rather wear one piece the rest of my I'd rather wear one piece the rest of my life than have that. I mean, they had to remove 8 pounds of skin and fat off my stomach alone.
Yeah.
That's what I said. I'm like, that was 8 pounds. So I have a video of me on the table, like right after surgery. and they have this big, like diamond shaped piece of skin, and they have it over my stomach, and then they lift it up and pull the sheet back on my stomach to reveal like the new tummy. And it's just mind blowing because I look at it, I lost one tattoo. It was like,
if you can't do laser tattoo removal, we can remove it with a tummy tuck.
Yeah, exactly. So if you ever have anything that you're regretting in like the lower area, you know, they can fix that for you. Just cut it off. But it was so crazy because everybody's like, wait, what? You had that much skin? It didn't look like it. And I'm like, it didn't look like it to you because I didn't show it to you.
Right. You know, and they didn't feel it every day when they sat down or bent over in their clothing. Yeah, no.
And that's another thing.
It's a huge deal.
And it looks a little loose, but then I would bend over and literally it was like one giant long strip of cow udder just like hanging from my stomach. I'm like, what is going on? It was terrible.
You know,
so, I mean,
that's what we're helping people with. That's what this is all about, is getting rid of the things that are a nuisance every single day, that you think about every single day, that your mind constantly goes to, and that's constantly weighing you down and tugging on your self-confidence. Like, this is what I'm in the business for, is to help you feel better about yourself and to be able to live the life that you want to live.
Yeah, it's so true. And I feel like everybody needs to do what is best for them as an individual, not what's best for Sally next door, because Sally next door isn't living in your body and isn't understanding what you're feeling in your head and how you feel about your body or perceive your body. I mean, I had so many people when I was like in my weight loss journey saying, oh my God, you look so amazing. Why do you need to lose more weight? Why do you need the surgery? And I'm like, I'm not showing you the bigger picture. I tried to be very transparent and very open, but I also can't go on Instagram and post everything, you know, even my bottom, like I might post a picture like in like pants or something where you can kind of see the curve or the outline. But for me, more so respectfully out for my husband and, you know, other things like my children and, you know, their school friends. There's some things that I'm not going to show, but I do tell people online, I'm like, listen, if you want to see my before and afters, like the true before, like at the surgeon's office, all marked up and after, let me know. I'll send it to you because I have no shame in my before and afters of the video. But what I don't want to do is actually post that online.
Yeah, you can't. Right. You have to have some discretion with what you're putting out there, because well, first of all, it's your journey. It's your personal decision to share what you want to share. So you don't have to feel good or bad about what you're doing. But also, like, you know, some of it's personal. Some of it you don't want to share. And it is between you and your surgeon, you and your husband, whatever it may be. But I'm just glad that you are open with what you are sharing. And like, I want people to follow you so that they can connect with you and watch your journey. Like, I love just like going through your feed and looking at the videos. Like, you post workouts that you're doing, like stretches you've done, you know, very open about the surgeries that you've had. And I just think that's super refreshing. So you're getting low on time. I know you have to go to like cardio or something like that, but, I want I know we've always got something as a mom, but I want everyone to follow you. So fashion and fitness, all the words spelled out, 316. That's your Instagram. Is there any other way that you want people to connect with you, or is that your main channel?
That's my main. Yeah.
Okay. So Crystal Murrell, fashion and fitness 316.
And they are free to ask me anything. I'm 100% open book about everything that I've done and all the little things that go with it. So
I love it. Thank you so much for sharing everything. This was super fun and super funny. And we're going to connect again soon.
Awesome. Thank you so much. Take care.
Thank you, everybody. Bye.
Bye.
Okay, the recording is stopped. Thank you so much. That was awesome.
I have a tendency to run on, so I'm sorry if you missed out.
No, it was perfect. We got through everything that I wanted to talk about. So I think it's so good. This will be really informative for people. And it'll be probably, I think I have like 4 or 5 that are going to come out before yours. So I'll text you. And obviously I'll tag you if I post anything about it soon. Oh, let me take a picture of our like little Zoom here for my story. Hold on. Okay.
Should we do duck face? I'm just kidding.
Okay, I'm going to smile. Ready? 1, 2, 3. Okay. It's good. It's good. Okay.
Okay.
Yeah, it'll be fine. I'll edit if I need to. Okay. So thank you again. If you're ever here in Florida, you need to text me.
Yes, absolutely.
And if I'm up there, I'll text you guys, obviously.
Yeah.
And Natalie's always wanted me to come up there. And it's just I just can't get away, between work and the kids.
Well, not only that, but who would leave Florida to come to Virginia?
That's kind of the other thing. I'm it's a little bit nicer here.
Yeah. I think when we came out there for my birthday, I think it was 2 years ago, we were talking about meeting up with you.
Yeah. I remember. I think it was last minute. I don't remember what it was, but I remember
very last minute kind of thing.
Yeah. Okay. Well, you look beautiful. Congratulations on your transformation, because you just are glowing and I love it. Thank you again for doing this with me, and I will keep you in the loop.
Yeah. Thank you. All right. Have a good one.
All right, bye.
Bye.